Endodontics case presentation. All of these improvements notwithstanding, notwithstanding, many patients still must be convinced that root canal therapy is an intelligent, practical solution to an age-old problem, the loss of teeth. See, many patients still must be convinced that root canal therapy is an intelligent, practical solution to an age-old problem, that is, the loss of teeth. Solution to an age-old problem, the loss of teeth. The case for endodontic treatment must be presented to the patient in a straightforward manner. The case for endodontic treatment must be presented to the patient in a straightforward manner. The patient with the correct oral image will be anxious to proceed with the therapy. Is this tooth worth saving? Doctor, this sentiment is voiced more often than not by the patient who has been informed that his or her tooth will require endodontic therapy. Superficially, this appears to be a simple question that requires a direct, uncomplicated answer. It should not be interpreted as a hostile or as a challenge to the treatment recommendations presented for the retention of the tooth. Psychologically, however, this initial question is a prelude to a Pandora's box of additional queries that disclose doubts, fears, apprehensions, and economic considerations. For example, is it painful? Will this tooth have to be extracted later? How long will this tooth last? Is it a dead tooth? Will it turn black? And how much will it cost? Following the first question, the dentist should anticipate such a series of questions. These may be avoided, however, by including the answers to anticipated questions in the presentation. In turn, the dentist will gain a decided psychological advantage. In turn, dentist will gain a decided psychological advantage. By this apparent insight into his or her problems, the patient is assured that the dentist is cognizant of the very questions the patient was about to raise or possibly was too reticent to ask. Most of the patient's fear and doubts can be allayed by giving a concise answer to each question. In today's world, the patient may have been offered the choice between saving the tooth by root canal treatment and extracting the tooth and replacing it with an implant. In today's world, the patient is given a choice whether the saving the tooth by doing root canal treatment or extracting the tooth and replacing it with an implant. Unless the tooth is hopeless, the dedicated dentist, one who believes in root canal therapy, should be able to make a positive case for retaining the tooth. The answer to answer patients' questions, the ADA has produced two inexpensive pamphlets entitled "Root Canal Treatment following up on your dentist's recommendations and the understanding root canal treatment. To answer patients' questions, the ADA has produced two inexpensive pamphlets entitled Root Canal Treatment, Following Up on Your Dentist's Recommendations and Understanding Root Canal Treatment. The AAE, American Association of Endodontists, also publishes a number of pamphlets for patients. The Your Guide to series, Endodontic Treatment, Dental Symptoms, Cracked Teeth, Endodontic Retreatment, Endodontic Surgery, Endodontic Post-Treatment Care, and Dental Symptoms. Although this approach is somewhat impersonal, it is a tangible reference. Particularly when the patient returns home and tries to explain to an interested spouse what endodontic therapy involves. It is a tangible reference, particularly when the patient returns home and tries to explain to an interested spouse what endodontic therapy involves. Based on previous experiences in the office, the average patient has sufficient confidence in the dentist's ability to help. The patient is ready to accept the professional knowledge and advice offered, but likes to have some part in evaluating the reasonableness of treatment. The professional person and the staff must spend time and thought necessary to understand the patient's initial resistance, which is sometimes based on false assumptions and beliefs in matters dealing with the pulpless teeth. The professional person and the staff must spend time and thought necessary to understand the patient's initial resistance, which is sometimes based on false assumptions and beliefs in matters dealing with pulpless teeth. However, once the patient is secure in the thought that this is the correct treatment, most of the fears and apprehensions related to unfamiliarity with the endodontic therapy will be dissipated. A dental appointment is still associated with fear in the minds of many people. You can see in the figure 11. Rashes or hives. The mere thought of treating the nerve of a tooth implies pain. The mere thought of treating the nerve of a tooth implies pain. Patients require reassurance supported by all available psychological and therapeutic methods of relaxation and pain control. Require all methods of pain control and relaxation. The patient must be reassured that endodontic therapy need not be painful and usually requires no more than a local anesthetic. All too often, we hear negative remarks about root canal therapy. Trying to do anything positive in Tacoma is akin to getting a root canal without Novocaine or view. What you just heard was a collective sin of relief following 7 months of agonizing root canal. Remarks made following President Clinton's confession on television. In contrast to these commonly heard excoriations, Lee Clary et al. Reported that 43.9% of endodontic patients reported a decrease in fearfulness after having root canal therapy. Furthermore, 96.3% said that they would have root canal therapy again to save a tooth. It should be explained to the concerned patient that root canal therapy is a specialized form of dental procedure designed to retain a tooth safely and comfortably. The tooth, when properly treated and restored, can be retained as long as any other tooth. It is not a dead tooth as long as the roots of the tooth are embedded in a healthy surrounding tissues. It is not a dead tooth as long as the roots of the tooth are embedded in the healthy surrounding tissues. Although teeth do not turn black following root canal therapy, a slight change in color owing to reduced translucency may occur. Discoloration associated with pulp necrosis and leakage around restorations can be managed successfully. Discoloration with pulp necrosis and leakage around restorations can be managed successfully. You can see in the chapter 38. Most often, retention of the tooth and bleaching, veneering or crowning. You can see in the figure 12. You can see in this picture, figure 12, a fractured premolar restored by endodontics and post and core crown. In A, tooth immediately following fracture. In A, see a tooth immediately following fracture will be look like this, right? Now in B, restoration and periapical healing. At 3-year recall. Note, spectacular filling at trifurcation and apex. You can appreciate by arrows in the picture B, right? Most often, retention of the tooth and bleaching, veneering, or crowning are preferable to extraction and or implant and replacement with a prosthetic appliance. There is a little doubt that economic considerations play an important role, and for some, a supreme role in the final decision. Some patients think financially, and even though they are able to afford treatment, they allow financial considerations to govern diseases, to governments to rule the decisions that should logically be made on psychological basis only. It is necessary to point out to these people the financial advantage of retaining a tooth by endodontic therapy rather than by extraction and prosthetic or implant replacement. In addition, it should be mentioned in all honesty that any vital tooth prepared for a bridge abutment might even virtually become a possible candidate for future endodontic therapy. And it should be mentioned in all honesty that any vital tooth prepared for a bridge abutment might eventually become a possible candidate for future endodontic therapy. Also, the patient who says pull it out should be informed of the problems that will arise if a space is left unfilled, that is, tilting, reduced masticatory efficiency, future periodontal problems, root caries, and cosmetic effects. Another commonly heard statement by the patient is, "It is only a back tooth anyway," or "If it were a front tooth, I would save it." But no one sees it in back. That this patient thinks cosmetically. The disadvantages of the loss of any tooth, let alone a posterior one, so essential for mastication, must be explained. Fortunately, today's patient is becoming more sophisticated too, tooth conscious, to permit indiscriminate extraction without asking whether there is an alternative. Extraction contributes to a crippling aberration from the normal dentition. Extraction contributes to a crippling aberration from the normal dentition. There is no doubt that a normally functioning, endodontically treated, and well restored natural tooth is vastly superior to the best prosthetic or implant replacement. There is no doubt a normally functioning, endodontically treated, and well restored natural tooth is vastly superior to the best prosthetic or implant replacement.